Hello again, everyone, and welcome to Smart Lawyers Love Dumb Nurses. Today's episode is about addressing exam anxiety. Today we're going to focus our attention on exam anxiety, also known as test anxiety, and what affects your performance because of your anxiety. We're going to talk about ways to decrease your anxiety and increase your exam scores. So I'm going to give you some keys to success. Now, you know life doesn't begin at graduation. It began when you made the decision to start nursing school. Hopefully you realize that you made the right decision. You're going to get through this, and I'm here to help you. If you've ever been hospitalized or visited a patient in the hospital, the nurse who cared for you or your loved one was once someone who had to study, struggle, and overcome exam anxiety and self-doubt to reach their goals. But they are living proof, and I am living proof that it can be done. Now, every day we need to cut out something non-productive in our life and replace it with something productive. That is called empowering ourselves. We must work on the positives. We also need to eliminate the negatives in our life. Remove everything that takes our time and our energy. Try to do this every single day. Because what we think about is really what we become. So you need to choose what to focus on. Are you focusing and thinking all day about failure and not being prepared to take a test or a performance exam? Are you worrying? Do you have self-doubt? Do you have guilt? Are you focusing in your day on anxiety? Choose to focus on positivity and love and determination. That is the key. Successful people have fear. Successful people have doubts. And successful people have worries. They just don't let those feelings stop them. They overcome those feelings. That's exactly what I want you to do. So I'm going to give you some success tips as a nursing student. For starters, when you are studying for an exam or for your HESI, and when you get ready for your NCLEX to pass your state boards, don't read every word of the textbook. Always read the first paragraph or two. Form study groups with people in your class or in your group. And I find that using flashcards to organize your information is very helpful. And it's been proven that when you recopy something from your notes or from a book, that very action of your pen and paper, making that contact and that connection, really helps your brain to focus on those words and on those concepts. Study a little bit every day instead of cramming everything the night before an exam or test. But the biggest advice I can give you, the most important, is study NCLEX type questions every week. And by studying NCLEX questions, what I mean is actual questions that are based on how NCLEX writes their questions. Now, whether you choose to do 10 or 100 is up to you, but I would make it at least 25 every other day. 10 a day, whatever is in your routine to get it done. I worked for NCLEX for 25 years. I've been all over the country writing and reviewing NCLEX questions for that national examination organization. I've been to Chicago many times. I've been to Princeton, New Jersey. I've been to Atlanta, Georgia, reviewing or actually writing exam questions. The questions are nothing new that you haven't researched or came in contact with in class. You can do it. But let me give you an example of what I'm talking about. Let's talk about medical surgical questions, because those are very common for your HESI or your NCLEX. What you must do is focus on what the question is asking you. So the first thing you must do when you look at an exam question is, what is the question actually asking you? You also have to understand the pathophysiology of the disease. In particular, know signs and symptoms. For example, if we're talking about something that has to do with pneumonia, what are the typical signs and symptoms? We know with pneumonia, we're going to have coughing. We're going to have congestion noted in one or both lungs. The client usually has a fever. Things like that. But if the exam question gives you the signs and symptoms, correlate those signs and symptoms in that stem of the question with the correct answer. But understand the pathophysiology of the disease. And in your mind, before you look at the possible answers, tell yourself, well, they're talking about this particular disease. Also be aware of what tests were ordered. Be aware of what complications are described in the stem of that question. What nursing interventions were discussed in the stem of that question, or what nursing interventions do you think you're going to have to do? And what are the treatments for that disease or that condition? Remember this, everyone, that every single exam question, whether it's HESI, NCLEX, or from a lecture, is based on the nursing process. It's either an assessment question, a nursing diagnosis question, planning question, nursing intervention question, or evaluation. And it's easy to remember the nursing process because it's ADPIE, A-D-P-I-E. Knowing that if it is an assessment question, it's going to give you the signs and symptoms. And if you're looking at signs and symptoms, then those key points in that stem of that question must match what is one of the possible answers in the question you're going to answer. So you must understand the typical and abnormal anatomy for a disease condition in the question. For example, if the scenario that you're reading about in the question is talking about signs and symptoms, for example, you would think to yourself, what does the client with bronchitis look like? So you want to think about what's typical for a client with bronchitis. Knowing what is typical will help you distinguish what abnormal looks like. Understand the nursing interventions for signs and symptoms of the disease in the question. Knowing what the signs and symptoms are is a straight knowledge-based question. So you want to understand concepts like, what should the nurse do first? Or what is the best nursing action? Those are critical thinking skills you need to apply. And quite honestly, The best thing you can do when you're reading that scenario is, what is one thing in the possible answers that I can do that will fix the problem? For example, if someone in the scenario has a severe wound to their arm and they're bleeding, and there's 4 possible answers, and one is call the doctor, another one would be apply pressure to the area, a third would be order some labs, and a fourth would be to raise the head of the bed. Which one fixed the problem? Well, calling the medical provider would not fix the problem, would it? Calling for a lab to check H&H would not fix the problem. Raising the bed or giving oxygen or checking their blood pressure would not fix the problem. The only one that would fix the problem is applying pressure to that site. Now, you may have to do all 4 or 5, but always realize that when you get a scenario, the most important thing you can do is to find the right answer that fixes the problem. It all begins with that concept. There also are questions where you must think about why the client is experiencing those signs and symptoms. So if a test question is giving you signs and symptoms, such as the client complaining of chest pain, you must understand why the client is experiencing that chest pain. By understanding certain things that the client is experiencing, that will help you see the big picture of what the question is asking. Again, always start with what is the question asking me. Get rid of all the distractors in those STEM questions. What is the question really asking me? Now, there are certain questions that are considered priority questions when we take an exam, HESI-NCLEX. In other words, you're given a choice of 4 clients to see. Which one would you see first? It's a very common type question. However, a lot of nursing students miss these priority questions. So how do you know what your priorities are? You've been told over and over and over, it's the ABCs, right? ABCs. And every time I ask students, what does that stand for? I get the same standard answer: airway, breathing, circulation. I want to change your thinking on that. Airway and breathing are the same thing, same concept. It's redundant, right? Airway, breathing. Well, airway and breathing are really the same thing. So I want to change your way of thinking. For priority questions, yes, we go by our ABCs. Let's change it to airway, brain, circulation. So if the question is a priority question, the first option you would pick would be anything pertaining to the airway, respiration, administering oxygen, etc. If airway is not an option, then look for the answer that focuses on the brain. In other words, are they having a stroke? Are they comatose? Were they once alert and now they're very confused? And go from there. And then if that's not an option, everything there is okay, then you move on to circulation. But don't forget that the ABCs is A, B, C, and then S for ABCs, right? The S stands for safety. If everything is fine with the airway, brain, and circulation, the fourth priority is to make sure that the client is safe. In other words, are they making comments they're going to harm themselves, or climb out of bed, or jump out a window? Are they going to harm somebody else? So the S for safety is the fourth line in your priority question. Again, focus on the stem of the question and avoid the distractors. Distractors are something that looks like it's the right answer, but it's to distract you. It is important to understand what exactly the question is asking you and looking at the information only pertaining to the question asked. Remember, practice makes perfect. The more medical surgical questions you do, the more exposure you will have and be comfortable when you see them on the test. Now, I always start with medical surgical because that's the largest group of questions. Now, you know you have to do a lot of studying regarding OB/GYN and specific questions for your exam, but it's always great to fall back on medical surgical. More nurses are in the medical surgical departments than any other field, in my opinion. So start with medical surgical questions, then you can get more specific as you go along. The more exposure you have, the more comfortable you will be when you see them on the test. And the more comfortable you are, the more your test anxiety goes down. So here's what I want you to do. Take a breath, read the question, and think about what the question is asking you. So let's go ahead and take a practice question. Practice question number 1. The nurse on a neuro floor is caring for a patient with a spinal cord injury from the waist down. What would the nurse expect to find in this client? So again, are there distractors? So what's going on here? What are you focusing on? So again, the nurse is on a neuro floor. What's the key phrase there? Well, neuro, caring for a client, a patient with a spinal cord injury from the waist down. Those are some key words, the waist down. What would you expect to find in this client from the waist down with a spinal cord injury? I'll let you think about it for a moment. Let me give you 4 possible answers, okay? From the waist down is a key for me in a neuro injury. Spinal cord injury from the waist down. So everything from the waist down is going to be abnormal. Everything from the waist up should be as expected. So are you thinking there's going to be a loss of sensation in the hands? Well, the hands are the waist up, so probably not. So get rid of that one. Respiratory difficulties. Well, again, we're talking about the above the waist area. The inability to speak. Well, possible problems there, but again, that's the waist up. But the 4th possible response, loss of bowel function. Well, there's been an injury below the waist, and the bowels are technically below the waist, so the chances are that the correct answer, and let's read the question again, the nurse on the neuro floor caring for a patient with a spinal cord injury from the waist down, what would you expect to find in this client? Loss of sensation in the hands, respiratory difficulties, inability to speak, loss of bowel function. And of course the answer is going to be loss of bowel function. Let's do another practice question. Again, practice makes perfect. A patient is brought to the emergency department for treatment. Now again, if it's an emergency department, remember that if the question is in that scenario, emergency department, that means that the problem is an emergency. That's why it's in an emergency department. It is critical. It's an emergency situation. So anytime you see a question that says a patient's in the emergency department or you are the nurse in the emergency department, it is an emergency. The potassium level is 5.9 milliequivalents per liter. Based on these results, which symptoms would you most likely see? So again, it's an emergency. It's 5.9. Now they always say in nursing you really should memorize things, but I disagree with that a little bit. You have to memorize and know labs. So in particular the Big Ten, and that includes your electrolytes. You have to know specific common electrolytes. We know from study and from memorization, right? Potassium normals are about the same everywhere. There's a little bit of fluctuation, but it's 3.5 to 5. Now you know that potassium level of 5.9 is high. So based on those results, what are we going to see? So based on that, here's 4 possible answers. Are you going to see a flushed face, hypotension, irregular pulse, constipation? Well, we know with potassium that one muscle that's affected is the heart. Now, I want to be very careful, and I want to slow down a little bit. So you know that if we have a potassium problem, the heart is affected, so the answer is going to be obviously irregular pulse. So be aware of that. But I also want to make sure you're aware that whether the client has a low potassium or a high potassium, that all muscle can be affected. And we have muscle everywhere. Now, the most important muscle in our body is, of course, the cardiac. So the answer is going to be irregular pulse. But if this was a select all that apply, the answer could also include constipation, because in our colon, we have muscle. And if we have a low or high potassium, the muscle is affected everywhere in our body, and that would include our colon. Where else do we have muscle? Well, we have skeletal muscle. So a high or low potassium affects muscle in the skeletal muscle area. So we could have muscle spasms, we could have muscle weakness. You see what I'm getting at? Where else do we have muscle? We also have muscle in our throat when we swallow. So the person could have difficulty swallowing. That's right. So while it's very important to know that, yes, potassium affects cardiac, but it affects every muscle, whether it's high potassium or low. The body doesn't really distinguish. So I want you to change your thinking a little bit. And again, that's the purpose of these podcasts, to give you something different to think about. But I have to be correct. I have to be right on the money. When you think of a low or high potassium, I want you to think of muscle. Because let's face it, they're not really going to give you a lot of questions anymore where cardiac is part of the issue. They won't even put that in there because it's too common anymore. Everybody on the planet knows that the first thing you look at with a high or low potassium is cardiac. But if that's not one of the possible answers, what do we look at? Well, we look at all the muscle. And that would include GI tract issues like constipation or diarrhea, because the muscle is affected. It could include nausea because the colon is affected by the muscle and everything backs up, and the client gets nausea. Could be muscle weakness, muscle tremors, difficulty swallowing, because in our throat is a lot of muscle activity going on, right? In this case, we know that the answer is an irregular pulse, but by these standards, that's a cupcake question, isn't it? I'm expecting on HESI and on NCLEX, they're not even going to include anything related to potassium with a cardiac issue. They're going to go with other areas for you to be aware of, and that includes muscle. So when you think of potassium, everyone, I want you to think of muscle. Let's continue with a couple more exam questions. The nurse is talking with a parent of a child who has been diagnosed with a Paget's disease. The nurse knows that this type of cancer affects which organ? Now, Paget's disease is not that common for you to know right off the top of your head, on the tip of your tongue, right? We don't discuss it very much. And also a child. So now we're talking about pediatric questions. So there are certain diseases that you have to know. But again, what's the key words here? Well, let's read it again. The nurse is talking with a parent of a child who has been diagnosed with Paget's disease. The nurse knows that this is a type of cancer that affects which organ? The possible answers are bone, brain, lung, and skin. So if you study Paget's disease, the cancer is affected in the bone. The bone. So how do we stay afloat now? How do we stay afloat? So let's talk about staying afloat as a nursing student, a young nurse. Again, I want to reiterate, do not waste your time reading every chapter, every word for word. Don't do that. Your mind can't consume all that anyway. My advice is understand the material, but don't memorize it unless it's labs. Here's my philosophy. I'm going to study while others are sleeping. I'm going to work while others are loafing. I'm going to prepare while others are playing, and I will dream and work while others are wishing. That's the philosophy I want you to have. So, set aside time to study. Get an egg timer or an alarm on your clock, on your phone, whatever it takes. Set aside time to study, even if it's just 15 or 30 minutes every day or a couple times a day. And during that time, that 30 minutes, 15 minutes, hour, whatever it is, set aside that time to study. Remember, you're not always going to work this hard. The keys to success in nursing school, let's talk about that. The number one advice I can give you is practice, practice, practice. NCLEX style questions. NCLEX style. For example, if the exam that you're taking will be covering diabetes insipidus, Addison's disease, Cushing's syndrome, practice NCLEX questions that cover the endocrine system. You see what I'm getting at? Because all those are covered by the endocrine system. Another important tip is read the rationales of what you got right or wrong. In particular, whatever questions you got wrong, read those rationales. They're free. They're right there. Read them. Many of the same concepts will be repeated on your lecture exam or in your HESI exam. The same concepts over and over. In conclusion, our continual mistake is we do not concentrate on the present day, the actual hour of our life. We live in the past or the future. We are continually expecting the coming of some special moment when our life will unfold itself in its full significance. And we don't notice that life is flowing like water through our fingers. Take the time now to study. Keep all of your notes, your lecture note, and take good notes. Take good notes. Continue to listen to people who are projecting positivity. And yes, I want you to listen to my podcast over and over. We want you to be successful. We want you to pass your NCLEX, your HESI, but I want you to pass your NCLEX, your state board on the first try, which I believe you will. Please let me know if you have any questions. I will continue to do these type of podcasts. You can reach me at brianlyon1957@gmail.com. Those of you who are my students, you know my email, and I look forward to reading your emails if you have questions or you getting in contact with me on our clinicals together or my phone. So I hope this helped you, and I will see you again down the road on your journey to success. Have a great day.